Good day, students! In this video lesson, we will discuss about safety practices in sports exercises. Individuals who engage in various types of physical activities, such as sports and exercise, have a higher risk of getting injured as compared to those who practice a sedentary lifestyle. However, the potential benefits of an active lifestyle outweigh the risk of suffering an injury. Most of the injuries are preventable, and awareness of the risk factors will help in reducing the risk. Furthermore, vigilance and safety measures can dramatically reduce the occurrence of injuries. First, let's define what are injuries. Injuries are damaged tissues or organs which occur when it encounters trauma or physical force that is greater than what it can resist or absorb. The tissues are able to withstand varying degrees of stress and strain, but it will break down if it experiences an impact that is stronger than what it can tolerate. Factors influencing the ability of our tissues or organ. Inherent, the characteristics, abnormality, age, technique on how we perform a certain activity, fitness level on how fit we are, equipment, and environmental aspects. Direction of forces applied to musculoskeletal structures. Tissues and organs react to the impact and direction of the force. We have three directions of forces. Compressive forces impact the center, causing it to bend or fold. Tensile forces are those that act away from the center of the structure, causing a pull or stretch. Shear forces are opposing forces toward the different ends of the structure, causing it to twist. Functions of various musculoskeletal. In here, we have the structure, the function, and the acute injury. Structure, ligaments. The function of the ligaments is to stabilize joints. Once na nagkaroon po ng accident, the acute injury is sprain. Second one is tendons. The function is to attach muscles to bones. And the acute injury is strain. Muscles. The function is to create movements. And the acute injury is strain. Bones is for anchor for muscles, and the acute injury is fracture. Joints, the function of joints is the fulcrum for movement, and the injury is dislocation. Injuries can be classified into two. So we have here the acute injuries. Acute injuries have signs and symptoms of pain. Pag sinabi nating pain, ito yung pananakit, and then swelling is yung pamamaga that manifest immediately after force application. So for example, kapag na-aksidente sa isang sport, pag once na natamaan yung part, the certain part is makakaramdam ng pananakit, and also magkakaroon po ito agad ng pamamaga. And the next one is the chronic injuries, also known as overuse injuries. It occurs after a long period of exposure to the force. When we say overuse injuries, these are common among individuals who have been training for a long period of time. So, ang mga nakaka-experience nito is yung mga athletes na ng ilang taon or ilang months wherein sobrang exposed sila sa mga physical activities, sa mga strenuous activities. So, it has a minimal rest and recovery between sessions. Ibig sabihin, dito yung katawan, yung muscles, yung part ng katawan is Minimal lang yung rest, yung pahinga, at yung recovery. Ibig sabihin, nabubugbog yung katawan nila sa training. So, nai-stress din po kasi yung ating katawan. Kaya pag once nai-stress, doon nagkakaroon po tayo ng mga damages. There are classification of sprains and strains according to severity, category, fibrous damage, and loss of function. The first degree are mild, has minimal tear, and it has pain when moved. The second degree or moderate has partial tear, pain at rest, and when moved. So kahit po gumagalaw or hindi gumagalaw, yung certain part is masakit pa rin po. Nakakaramdam pa rin yung pain ng isang athlete. And the third degree is the severe. So ito na yung malala. Complete tear, complete loss of function. There are three types of overuse injuries according to severity: the stage 1, stage 2, and stage 3. Athletes with stage 1 injury complain of pain only after the activity, game, or training session, while athletes with stage 2 injury complain during and after an activity but do not feel it during rest. However, in stage 3, the athlete feels pain whether at rest or play. Factors that increase the risk of injury. It is widely accepted that people engaging in sports or fitness training have a higher risk of getting injured. Children and older people are also at a higher risk because of poor motor control and weak musculoskeletal structures. There are certain characteristics or factors that increase the likelihood of injury. These risk factors increase the susceptibility of the individual to injury, but it does not cause the injury. Risk factors are classified as non-modifiable, for example, the age and gender; modifiable, tournament rules, apparel; intrinsic, individual factors; extrinsic, environmental factors. Why does a body part swell after getting injured? During acute injuries, the body will initiate the healing process through the inflammatory response. The inflammatory response removes the damaged tissue by increasing blood flow and activating the lymphatic system to the injured site. Swelling occurs due to fluid accumulation as a result of increased blood flow and blood vessel permeability. Aside from swelling, inflammation is also characterized by pain, redness, and warmth. The muscles surrounding the area contract to guard the injured site and prevent aggravation. During inflammation, special cells remove the damaged tissue to provide a foundation where new tissue can grow. The entire healing process takes several months to a year to complete. As you can see in this table, these are the common causes of acute and overuse injury. This is the injury, the type of injury, common cause of injury. Sprain is an acute injury, and the common cause of injury is twisting or pulling force. Strain is also an acute injury, and the common cause is pulling force during rapid acceleration. Fracture, an acute injury, is caused by falling or breaking a fall. Dislocation, also an acute injury, is caused also by falling or breaking a fall. Stress fracture is an overuse injury and is caused by repetitive high-impact stress. Tendinopathy, an overuse injury, is caused by the repetitive movement using poor technique. Osteoarthritis is an overuse injury caused by repetitive high-impact stress. And bursitis is an overuse injury caused by the repetitive movement using poor technique. 5 common sport injuries. Sprain. Sprain is one of the most common injury in sports. When we say sprain, it is a stretching or tearing of ligaments, the tough bands of fibrous tissues that connect two bones together in your joints. The most common location for a sprain is in your ankle. Initial treatment includes rest, ice, compression, and elevation. Mild sprains can be successfully treated at home. Strain. A strain is defined as an injury to a tendon, tissues that connect your muscles and bones, or muscle. It is a twist, pull, or tear of muscle or tendon. Strains can range from mild to extreme and may mean your tendon or muscle has a partial or complete tear. Fracture. A fracture is a broken bone. It can range from a thin crack to a complete break. Bone can fracture crosswise, lengthwise, in several places, or into many pieces. Most fractures happen when a bone is impacted by more force or pressure that it can support. Dislocation. A dislocation is an injury to a joint, a place where two or more bones come together, in which the ends of your bones are forced from their normal positions. This painful injury temporarily deforms and immobilizes your joint. Dislocation is most common in shoulders and fingers. Concussion. A concussion is a traumatic brain injury that affects your brain function. Effects are usually temporary but can include headaches and problems with concentration, memory, balance, and coordination. Concussions are usually caused by a blow to the head. Sports injury prevention. Most sports injuries can be prevented with adequate preparation and proper knowledge. The following strategies can minimize the occurrence of these injuries. Number 1, adopt a comprehensive training program. A comprehensive training program goes beyond addressing the fitness parameters such as aerobic capacity and strength. It is a holistic program that suits an individual's needs and demands. The individual must first assess the weakness and abnormality of his or her movements and fitness to be able to customize his or her training program. The program contains the correct exercise and proper execution as well as posture, corrective exercises, core exercises, stability exercises, and other exercises that will improve neuromuscular efficiency. Number 2, use protective equipment and practice correct technique. Individuals derive fun from playing sports and other physical activities that they sometimes forget to wear proper protective gears. Injuries while playing a sport or game can be prevented by using some protective equipment. An individual should also learn the correct technique to avoid injury. An incorrect technique may put the musculoskeletal structure into an awkward position, which leads to injury. Number 3, incorporate recovery strategies in the training program. Training and exercise is a controlled form of stress that stimulates the body to become stronger. While it is important to train and exercise, it is also necessary to incorporate recovery in the routine. Recovery provides the body time to rebuild broken musculoskeletal structures. Hence, an individual should also eat properly to help the body restore lost nutrients. Number 4, follow rules and decorum during competition. Tournament directors and sports officials draw up rules and regulation for any competition to maintain fairness and safety for everyone involved. These rules should be strictly enforced to prevent excessive physical contact that might lead to injuries. It is important to practice sportsmanship and to resolve conflict without resulting to violence. How can the possibility of getting injured while training be minimized? Fitness and training injuries can be prevented if an individual takes the necessary preparations and precaution on the following variables. First, proper attire. The attire should be appropriate for the chosen activity. Number 2, proper technique. An individual needs to consult a trainer and ask for proper instruction in performing the chosen activity or exercise. Number 3, gym etiquette. Individuals that subscribe to gym facilities should be aware of the rules and etiquette. Number 4, proper environmental conditions. It is advisable to check the environmental conditions before the exercise session. And number 5, adequate recovery. The recovery period is just as important as the workout session. And before I end my discussion, I would like to end our lesson with this quotation. Safety is always the top priority. Thank you, students, for listening to our lesson. I hope you have learned something today. See you on our next video lesson.